Interesting topic. It's an awareness week of epic proportions right here. We can't underestimate the value of organ donation, National Organ and Tissue Donation Donation Awareness Week. Katie, Jillian, and Ed from BC Transplant joining us right now. And Ed, before we talk about the increase in donations, I want to dive into the personal story. You both have received 2 transplants, heart transplants, which is simply incredible to say. And Jillian, tell us about what you were diagnosed with at the age of 28.
At the age of 28, I was diagnosed with heart failure of unknown cause. It's suspected that a virus attacked my heart. And immediately I went into heart failure and lived with heart failure for 10 years before I had my first heart transplant. And I was on artificial heart pump at that time as well. And so it's been a crazy ride. And then I had that heart for 3 years, a little over 3 years, and I went into chronic rejection, and I'm 3 months out now from my second heart transplant.
3 months out from heart number 2, and if you can give us a glimpse of what the struggle was like, the potential wait to get the heart that would be the right fit, and then the reality after having the surgery, just saying it's such a short time since the second heart, and you look like things are normal.
Yeah, well, looks can be a bit deceiving. I'm shaking on the inside right now, mostly from the medications. But I waited 13 months for my first heart, and the second one I was in hospital, and I only waited 2 weeks. So it's really hard to say, you know, exactly how long you're gonna wait, but it's difficult no matter what, because you're really you don't really have a future to think about, and so yeah, that's really kind of where you sit.
It's a great deal of uncertainty, and we're seeing some of the photos of the reality you face. Now, you met Katie during this process. Katie, at the age of 7, you had your diagnosis.
Yeah, that's right.
What was the reality you were faced with?
So when I was 7 years old, I caught a virus, so it wasn't a condition that I was born with. And the doctors told my parents that the only thing that would save me would be a heart transplant, and they weren't doing them in Canada at the time. So I had to fly to Pittsburgh in the States to have it performed. And I had my first transplant for 30 years. And then I just recently, 11 weeks ago, had my second transplant, and that's when I met Jillian in the hospital.
And now you have that sense of community. And how has the community rallied, Edwin? I mean, you're overseeing the provincial operation here in BC. How are organ donations, how have they changed? I mean, Logan Boulet was a big story with the Humboldt Broncos of his willingness to provide, you know, those organs. What's changed?
You know, National Organ Tissue Donor Awareness Week, as you said, so it's about donor awareness. What we want is we want people to register. We want people to let their families know, and we want to celebrate the recipients. You know, because without the organ donors, they might not be able to be here today. With the tragedy that happened in Saskatchewan, we had a young hockey player who registered, had the maturity to register to be an organ donor and tell his family, and in his death left a legacy of saving 4 lives. That's tremendous, and that's what's changed. We're seeing a real uptake in the number of registrations that we're seeing coming into BC Transplant.
You know, it's excellent to hear, and the community of support that exists for the reality to go through the big health change. What have you seen of the support you receive after you've gone through the transplant process? Katie?
Well, the support from everybody has been incredible through social media and you know, through the hospital, all the people who work at the hospital, through BC Transplant. There's so much support out there, and it seems like organ donation awareness is becoming an up-and-coming thing, and it's really great to see.
And tell us quickly about HeartLife, because I know that's a big passion for you.
Yes, absolutely. One of the things going through heart failure, it's a very lonely process, as I've also found going through transplant as well. And so the HeartLife Foundation is something that I established with a close friend of mine, Mark Baines, and our aim is really to raise awareness for heart failure and organ donation, and in hopes of really bringing the patient voice to the table. And so through our organization, we've met lots of people like Katie, and we've been supporting each other, and we've really started to reach out across the country, and we've been doing some advocacy work with the provincial government to help bring heart heart failure to the forefront.
Well, you've done a great service today sharing your story. Ed, what's the website again if people want to get involved?
It's www.transplant.bc.ca, and please register and let your family know.
Excellent. Thanks to you three. We'll take a break right now.